It seems like a simple concept, person-centered care. After all, if you want to know what someone needs or wants, you ask them, right? But in the medical industry, it is very easy to see a person as their disease or ailment and disregard their wants and needs as a person. This can lead to patient distress, misdiagnosis, unwillingness to cooperate, and many other things that can interrupt a person getting the care that they deserve and need.
McCormack and McCants outline the person-centered care framework as the prerequisites of person-centered care that focus on the care environment and the care processes. This encourages people to be involved in the decision-making when it comes to their care, and results in them feeling heard and understood, thereby making for a smoother, more transparent care that is easier on both the patient and also the medical staff. In today's presentation, we are focusing on the person-centered care processes.
Working with the patient's beliefs and values. While working close to people and their families through their care journey, it is essential to work with their values and beliefs. We need to be able to identify differences and respect them, understanding that we do not need to know everything about that person or their beliefs to provide care. To be able to do this effectively, it is also essential to have a good understanding of our personal values and beliefs, as well as cultural differences that we may have, so when faced with these differences, we can respond appropriately. Section 3.2, Section B of the Code of Conduct for Nurses states that nurses must respect diverse cultures, beliefs, gender identities, sexualities, and experiences of people, including among team members. By doing so, this allows for a more understanding and person-centered care to be possible. Engaging authentically. A study done in the American Institute for Research involved both patients and their families throughout the treatment process. This worked through the stages from diagnosis to treatment and found by including the patient and their family, it benefited both the patient and the medical team mutually. Engagement in the person-centered direct care is one of the critical elements in being able to provide adequate care for the patient and their families. The ultimate object of engagement as the development of a collaborative partnership between patients, including families, and consumers and health professionals. The definition also implies that the end purpose of this relationship is to improve healthcare and health outcomes for both individuals and society. Patient education and family engagement describes the continuum of engagement through consultation, involvement in partnership, and shared leadership, whereby patients receive information about their diagnosis, their preference for treatment are discussed, and then a decision is agreed on by combining the patient's preference, medical diagnosis, and clinical diagnosis. A lack of engagement from either nurse, patient, or their families can present a challenge that could lead to inadequate care. Nurses and medical staff should consider this and make allowances, such as being mindful to speak in terms that will be understood and keep communication lines open at all times. Doing so will allow for any concerns to be addressed so as not to impact the effectiveness of their care.
Sharing decision-making. Shared decision-making is an element of the person-centered care framework and care processes that looks at health professionals facilitating patient decision-making regarding treatment, care options, and processes. Implementation of the shared decision-making process also helps to develop therapeutic relationships between the healthcare team and the patient. A lot of the time, there is a power imbalance that exists between these two parties that can affect shared decision-making. This is because some people hesitate to ask questions when their doctor prescribes them treatment or medications that they don't know about, and they feel as if the doctor knows best and that they're not allowed to ask questions. Except these people, the doctors, do not always know best, and patients should never feel as if they shouldn't ask questions or be embarrassed because they need somebody to re-explain something to them. And they definitely shouldn't be consenting to anything they do not understand. It is the responsibility of the healthcare team to ensure that their patient has been informed and understands the care being provided. Being sympathetically present.
Being sympathetically present implies engaging not in the superficial aspects of a person, but for their value and their uniqueness. This demonstrates key elements which construct the healthy relationship between practitioner and patient. This lays at the bedrock of all person-centered care approaches. The components underlying the sympathetic presence are beginning the therapeutic relationship by understanding a person's limitations and recognizing their losses, passively listening, acquiring insight into their values and beliefs, patiently waiting for the cue to validate the important agendas in their life, thusly maximizing their coping mechanisms, and prioritizing.
Providing holistic care.
Providing holistic care results in an expansion of awareness that is able to encapsulate the individual as a whole, not separate and distinct parts, but as a complete and independent system. Factors include spiritual, existential beliefs, cultural influences and family, physiological, bodily function and structure.
If these care processes are executed properly, the following person-centered outcomes can occur. The patient should feel as if they have had a good care experience and were involved in their care and now have a sense of well-being. There should also be an existence of healthful culture within the health professional's environment. Leadership is not about a hierarchy or a person's rank. Leadership is about being a role model, someone people look up to, follow, and trust to work with you towards a common goal. Sometimes, however, leadership skills fall through the cracks and challenges arise. There are times in nursing when a nurse is torn between the patient interests and policies that drive organizations, often faced with the challenge to be a leader for either their team, a patient advocate, or to follow the rules set by the facility. Say, for example, you are looking after Mr. X, who is a high fall risk and very confused. Yesterday he had a fall and multiple near misses prior to that. To ensure his safety, you arrange for a special for him during the day. However, the facility policy limits 2 specials on one ward at any given time, and 2 beds already have specials. What do you do? When the safety of a patient is supposed to be number one, but the facility policy limits your ability to ensure that safety. This is a challenge that may be faced when trying to facilitate person-centered care, where the goal of person-centered care is different to that of the policymakers.
Person-centered care is not a rigid fixed system. The main functional advantage is its malleability. An interesting example of this is pet therapy, otherwise known as animal-assisted therapy, that has shown positive effects in dementia patients. It has established the evidence base for the fundamental importance of relationships and attachments that comprise contemporary dementia care. Studies demonstrated its effect in decreasing anxiety, increasing cognitive function, and lowering the need for antipsychotic medication. All different types of animals have a positive effect. Dogs are more commonly used as they have been our best friend for vast spans of time. Animals encouraging socialization, physical activity like walking, and mental activity like recollection and motivation. Investing in an animal is believing in tomorrow. It is having something to live for.
With that, remember to practice person-centered care. As defined by McCormick and McCants, person-centered care focuses on treating people as individuals, not as their illness or their UR number. Respecting their rights as a person, building mutual trust and understanding, and developing therapeutic relationships. This also creates a better environment for both nurses, healthcare workers, and the patients to be within.